We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers on the rise throughout the country and increasing here in Florida, this leaves many residents questioning what we should do next. Face masks are still required throughout many Central Florida communities, and more vaccine and testing sites are opening to accommodate the numbers. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining me is Alvina, epidemiologist with the Florida Department of Health in Orange County. Alvina, thank you for joining us today.
Thank you for having me.
So let's talk about your profession, about epidemiology and what role it plays during situations like this pandemic, and how has your job changed in this past year?
Well, currently, as far as how my job has changed in this past year, it's pretty much been all hands on deck for anything that's needed, especially since the declaration of the public health emergency. But my primary goal, or my primary role as an epidemiologist, is to focus on how the disease spreads and how we can prevent it and how we can put in interventions to prevent the transmission and prevent the increase of cases and subsequently hospitalizations and deaths.
And with the numbers rising here in Florida, what do we need to know about some of the variants that we're hearing about? The South African variant, the British variant, what do we need to know about that? So
there's actually a lot of variants. The ones that so far have been publicized are the B.1.1.7 that's out of the UK and the B.1.351 out of South Africa and the P.1 out of Brazil. But actually, we are tracking virologic surveillance in many different countries, is tracking the mutations that happen with viruses. And as far as the virus replication goes, this is not an unusual thing. So the primary goal of the virus itself is basically to infect a host and reproduce. That's really its only function. And so every time we go through these infections, every time there's passage through a human being, or every time there's replication, the virus has this opportunity to mutate. And so mutations are something that we actually would expect, and we see that happens. And the rate of mutation actually is influenced by the number of infections, so like how many times it passes through a human. And also it's affected by basically selective pressure. So as the virus is seeking out essentially all those persons who are susceptible, and so the more infections we have, the virus has this opportunity to seek out susceptible persons, so it won't go to the people who have already been infected, it'll go to the people who haven't yet been infected, and so it'll seek out these pockets of susceptibility. And so every time this happens, this is our biggest concern. So essentially, no one is protected until everyone is protected. So while there are people who are susceptible, whether they haven't had the natural infection or whether they haven't had vaccine yet, there is this possibility that the virus will go seek them out, infect, and mutate. And so right now, with the onset of these variants that we've identified on our shores and in the world, the possibility, we are in a race, essentially, for the vaccine that we've developed. We've developed it against certain proteins and certain strains, and so we're trying to outpace the mutations themselves. And so it's essentially, we've got our garden hose in a forest fire, and so we need to contain the pandemic while we have it, use the tools that we have, which is the pandemic precautions, plus our really good and effective vaccines to try to bring down the pandemic and keep it under control before another spread can occur with a variant or a mutation where we don't have an effective vaccine or already good built natural immunity.
And is there a difference between a variant and a strain? Are those two different things, or is that the same thing?
It essentially refers to the same thing. A variant just means some kind of difference between when you compare two things. So there can be very small mutations and there can be somewhat large mutations. And so it's mostly semantics. Strain is, whether or not you want to call something a new strain is semantics.
And we're hearing about these variants that they are more contagious, that they're more virulent, I guess is the word. How should we be protecting ourselves any differently, or should we be doing anything different at all?
Right. So virulence and infectivity or infectiousness are two slightly different things. So these new variants can be more infectious, or they can infect more people because there may be more people who are susceptible because they are slightly different than what may have been the original strain. There might be more persons who are more susceptible. And as I mentioned, the virus will seek out persons to infect. That's sort of its primary goal. And so the faster it does that, it's met its goal, the more people it can infect. Virulence refers to the severity of the infection or the illness that the virus can cause. And so I haven't seen studies yet to show that the virus itself is more virulent in that it causes more severe disease. So far, what I've seen or what I've read has shown that the new variants can be more infectious. And so, regardless of whether or not we have the original COVID strain or the variants, the precautions remain the same. And so, I think we talked about this before about for pretty much any infectious disease or most infectious diseases, the pandemic precautions work really well to help prevent the spread of infection. So, wearing of a mask to contain respiratory droplets, watching your distance, so maintaining a 6-foot distance from others around you, and good hand hygiene or washing your hands.
Excellent. And also, you mentioned that we are sort of playing beat the clock with the vaccines and that it's important to get that done. Can you talk a little bit about the registration process and who's eligible right now and where we are in that process of getting to, everybody? Right.
So currently, we have a prioritization that the governor has set, and right now in Orange County, we have a mass vaccination site that is vaccinating those persons who are 65 and older, and also we are working with several community partners to vaccinate healthcare personnel, frontline healthcare personnel who have direct patient contact. And so those we've worked with two of the major hospital systems, so Orlando Health and Advent Health, have opened up vaccinations for those frontline healthcare workers. Also at our mass vaccination site at the Orange County Convention Center, we are vaccinating EMS or emergency medical service providers.
And is there sort of a marker that you would be looking for to know whether or not the vaccine is making an impact in the community? Is there something that we should be a marker, like X amount of people being vaccinated or the numbers going way down? What do you look for to know that there's an impact of the vaccine is having?
So that's a lot of confounding factors in trying to determine whether or not the vaccinations are having like a good impact. One part is using our epidemiology programs, our epidemiology skills to try to track the cases, hospitalizations, and deaths. And so looking for decreases in those. I think what you might be getting at is potentially herd immunity or community immunity, and that's that we have to take into a context about what population we're studying, because that immunity may increase or decreasing depending on the susceptibility or previous rate of infection in the population that you're looking at, and also the say opportunities that population may have to be infected. The general population that lives at home within their own families is different than, say, a population in a long-term care facility or a nursing home where they're in a congregate living setting and they're, say, not basically a closed population. So we're looking at different factors. One part is the most important part, I think, is the decrease in the number of cases over time, not just a fluctuation in trends, but certainly over time, and also the decrease in the hospitalizations and deaths.
And finally, I don't think we can ever emphasize enough the pandemic precautions that you mentioned, and just telling everybody once again what we should be doing. This is not the time to take your foot off of the gas when it comes to keeping yourself safe. Well, what should we be doing?
Right. So we're really, as I mentioned, we're in this critical point where we are trying to rapidly contain the spread of infections, and we do that in a multiple different ways. And so we shouldn't let up on one part. We need to use all the tools in the toolbox and at the same time. So it's not a fight between say one thing or the other. Should it be vaccine or should it be mask wearing? It should be, we should do all these things together so that we can get a handle, reduce the amount of the population that we need to protect so that we can protect everybody. And so the pandemic precautions will protect us from any current rate of transmission, any current spread, so reducing the amount of spread. And then whether or not you have the variant, the same precautions will help prevent transmission or help reduce transmission of that. And so mask wearing to protect against to prevent respiratory droplets from escaping, but also it helps, large respiratory droplets from coming at you and then you inhaling them, and then good hand hygiene and hand washing, and then also watching your distance. So saying socially distance or 6 foot distance from persons. And, I can't emphasize enough, the Super Bowl's coming up, and maybe large crowds and exposing yourself to persons that you haven't been living with in your household. It's now we are still in this crucial point where we're trying to contain the infection. So not attending large gatherings or hosting large gatherings, not going out to, say, public spaces where there might be a lot of persons who can't or don't mask or socially distance. And then the other thing I wanted to throw in there is about the cheering and the shouting. So not to be a downer, but it would be, if you're going to be doing that, please stay socially distanced and wear your mask. And CDC actually recommends that you don't shout or cheer, but I know that might be difficult if there's a Super Bowl on the line.
Right, exactly. And the sooner we adhere to those pandemic precautions, the sooner we get to our new normal. Alvina, thank you so much for being with us today and keeping us informed from the front lines. It's always good to see you.
Thank you.
And stay with us. We'll be right back with more. The vast majority of frail older adults live at home, and this includes individuals living with multiple chronic medical conditions, functional impairments, or cognitive decline. Nikki Magyar is with Right at Home Orlando in-home senior care, and she's joining us to explain how professional home care agencies are working to meet the needs of older patients during COVID-19. Nikki, thanks for being with us today.
Thank you for having me.
So tell us about what in-home care services are.
Well, Right at Home offers caregiving services ranging from transportation, grocery shopping, medication assistance, bathing, toileting, ambulation, those kinds of services that help someone stay at home and still live a good, full life. In-home care in general makes it easier for loved ones to stay healthy and active as much as possible at home or in an assisted living facility even.
And I mentioned a little bit about the profile of the people you serve, but tell me about your patients and what kind of needs they have.
Absolutely. So we service Orange, Osceola, and Seminole counties. Our clients, like, say, Miss Beatrice, she lives alone at home. Originally, we were just taking care of her to help her with light housekeeping, shopping, things like that. As she aged, we helped her with a little more things like in and out of the shower. Maybe she would start forgetting to take her medications. And then now she actually lives at a community where we visit her a couple times a week and make sure that she's staying active and just having more cognitive support there.
And one of the things that's...
No, it's okay. We also help with bedbound patients that, maybe they're not able to get up on their own. So we transfer them into their wheelchairs, and then we're able to feed them and help them, have their best day as well.
And it used to be that a lot of people who were in that situation, like Beatrice, would be in a nursing home. But there is a lot of value to having older adults stay in their homes. Tell us about that.
Absolutely. It seems like the growing trend has been people are staying in their home as long as they can. So they're, trying to manage as much as they can with a little bit of assistance, whether that's a professional caregiver like our company or a family caregiver that can help them with little activities throughout their day, whether it's something small like groceries or medication assistance like we talked about, or if it's all the way to you need help with bathing and toileting and grooming and those types of things.
You know, COVID has changed pretty much everything, and I wonder how that has changed the way that you operate and operate around patients these days.
We definitely have put quite a lot of new protocols in place. It has been an ever-changing situation. Our goal, no matter where the person lives, is to keep their safety and dignity in place. So we've been using universal precautions from the beginning, but now we're faced with a disease that's much more contagious, and we know a lot less about that. So we're putting extra layers of safety precautions in place, and all of our nurse assistants are equipped with gloves and masks and all the PPE that we can give them.
And are they tested before they go into people's homes? And what's that procedure look like?
Yes, fortunately, we were able to have our care team tested each week so that we're able to continue to go into people's homes or go into care facilities with, with confidence. And that has been, at first it was challenging, but we had the support of a lab that we got in touch with in the very beginning of all of this last spring. And we're able to, basically what we do is we take the sample in our office. We have the caregivers come in each week, and then we FedEx them out and we get the results right away. So it's been actually a pretty seamless process now that it's been put in place.
What happens when either the patient or the caregiver tests positive? How do you handle those situations?
Sure, we have a decision tree, and we also call all of our caregivers and all of our clients daily. So we like to check in with them normally, but now it's for a different reason, to make sure that they're, if they're not feeling well, we need to know if there's a reason behind that so we don't put our employees at risk. But also we check in with the caregivers to make sure we're not putting our clients at risk.
Now, can the in-home workers help to schedule an appointment for a vaccine? Is that something that they would do?
Sure. We've been trying to give all of our clients and anyone who calls us also all of the websites and links and any kind of information we've been able to come across through the county to be able to provide them and help them set up those vaccine appointments.
Now, can you actually help someone who is transitioning from the hospital back into their home? Because that's probably when they need the most services. Is that something that Right at Home does?
Yes, so we have a care transitions program, which started out basically saying that you're getting discharged from a rehab or a hospital, you need a ride home, you might have old food in the fridge that needs to get thrown away, you might need to set up another doctor's appointment, you might need to fill a prescription. We can do all of that for you and get you settled in. Now with COVID, there are some people who are being discharged that might actually need to quarantine when they get home. We have been able to help in those situations as well. So we are taking on COVID positive clients. And what we do is we have a team of caregivers that are organized to do that. They don't take care of anyone else but those people. And then we have other caregivers that, take care of the negative testing clients, of course.
Excellent. Well, Nikki, thank you so much for giving us an idea of how the in-home care companies, providers are actually working to keep both the patients and the workers safe. Thank you for being with us.
Thank you for having me again. Have a great day.
You too. And we'll be right back with more. Stay with us. We've heard from a variety of leaders today working to keep us informed about the coronavirus pandemic, from local government, the medical community who's on the front lines dealing with the pandemic, and organizations who continue to serve this community. And of course, we are also here to help you keep making those healthy connections. Stay safe.